At SRM, the financial counselors, our role is to confirm insurance benefits. So we call the insurance company, verify the benefits, and find out if there's any lifetime maximum on the benefit for fertility treatment, and then whether any deductible or co-insurance will apply, so that we can best estimate the out-of-pocket costs for the patient. There are definitely restrictions on every insurance plan. The benefit is going to vary just plan to plan. So that's why we do try to call the insurance directly, ask all of these questions, whether there's benefit for IUI treatment, IVF treatment. Some plans do exclude IVF treatment, but they'll pay for IUI. So we're always trying to find out what those restrictions are. Just because your coworker might have a benefit for infertility doesn't necessarily mean that you do, because it all comes down to what plan you select specifically. So it does happen sometimes where a patient will call their insurance company and just ask, do I have fertility benefits? And the insurance company will tell them yes. But then when they come into the office, it turns out they don't actually have fertility treatment coverage. They only have coverage for diagnostic services. And the insurance company didn't specify that with them on the phone. So it's always best to be as specific as possible when checking on your benefits with the insurance company. So it's helpful because the financial counselors can help to navigate that process, because we know which questions to ask and what terminology to use with the insurance company as well. If a patient's going through fertility treatment, there's no way for their management or HR or anybody at their company to know that they're going through fertility treatment unless they tell that person themselves. The insurance company won't tell their employer that they're going through treatment. The deductible and copay and any out-of-pocket cost always varies plan to plan. Most plans are structured where you have a deductible to meet, so a dollar amount where you're basically paying full price until you meet that deductible. And then once the deductible is met, that's when your co-insurance kicks in and you start paying a smaller percentage. Most of the time when going through fertility treatment, the first step after you have that initial consultation with the doctor is to do a series of diagnostic tests. Those could be blood work or ultrasounds to check on your ovarian reserve, or uterine evaluations to assess the uterine cavity, or a semen analysis is another common diagnostic test for the male partner. So if there is insurance benefits for infertility treatment that a patient has, in most cases, insurance will pay for the diagnostic testing as well that goes along with that. However, it's always possible that insurance might deny that, or it's possible that you could have a separate insurance benefit for fertility treatment only, and that medical insurance would cover any diagnostic services. So it's possible it's just a different plan that would need to be billed for the diagnostic services as well. So with genetic testing, it's always important to consider that there are two fees associated with the genetic testing of the embryos. The first fee is for the embryo biopsy, which SRM performs, so we bill for that. And then the other piece is for the actual testing of the embryos, which is billed separately by the lab doing the testing. So it's always a good idea to check with your insurance. Even if you do have fertility benefits, they often do have restrictions on genetic testing of the embryos, unfortunately. So that's something that your financial counselor would always assist with to find out, if they do restrict genetic testing of the embryos or not.
When you're billing storage to insurance, it's always covered separately. It's not included in your freezing of your specimen. It's not included in your IVF pricing. It's always a separate benefit. If you have insurance coverage, most insurance covered plans only allow you to bill yearly for that. If you are seeking fertility treatment, you would want to contact your insurance company, find out what is stated in your benefit packet for coverage, if you have testing, if you have treatment, and then you would want to set up your appointment with your endocrinologist, fertility endocrinologist. We can go over all of your diagnostic questions, all of your treatment questions, and then how that correlates with your treatment plan and what's covered with your actual benefit. If you are a patient who has fertility benefits and your plan requires you to seek out a center of fertility excellence, SRM is in that network and you would be able to see one of our providers.
Insurance benefits are confusing enough on their own. And when you add in infertility treatment and all these different terms that people are not generally familiar with, that adds another level of confusion. So patients are often frustrated and confused about how to navigate their insurance benefit in general, and you don't really think to ask these questions until you need to. So a lot of patients become much more educated with how insurance billing works while going through this process as well.